how are you? Good, good. And I see that little Timothy's fine too. It's so crazy. I swear he already favors you. Well, as much as I'm sad to say it, I do have your discharge papers. Good for you, bad for me, because I've developed this bond over the past few days, and I'm going to miss you guys. But, anyways, considering you are a new mom, it is going to be a lot to digest at one time, so if you have any questions throughout it, just make sure to ask me, okay? Okay, so I'm going to refer to it myself as well. It kind of makes things easier. So the first section is going to be general activities. So basically, the more you're up and out of bed and the faster you go back to your regular daily life, the more your body's going to catch on quicker. So you're going to start shedding that weight faster. Your body's going to start saying, oh, let me wake up better. Let me go back to my routine. Let's see here. One big thing in here that we like to kind of emphasize with our patients is to avoid heavy lifting. So your body did start releasing that relaxin in the last few weeks, kind of help with delivery and all. But in terms of heavy lifting, you can actually pop your shoulder out. So you don't want to do that. That wouldn't be a good start to things. So make sure to not lift anything heavier than your baby in the car seat. That should be the heaviest thing that you're lifting. You shouldn't be going around lifting 50-pound boxes for your neighbors, helping them move in and all that such. I know you're really nice. I can tell you're a really helpful person, but we can't be doing that for old Sandra next door. She can go get someone else. So, let's see here. Oh, I just want to address too, it's very common for women after pregnancy or delivery to have swelling, especially in their legs and feet. That's completely normal. You developed all this extra fluid during pregnancy. Your body's going to start ridding that off. And to make it easier, go ahead and drink some more water. It's going to help you actually pee more of that water off and be a faster progression. Let's see here. What I will say is if you have that unilateral swelling, like say your right or left leg is more swollen than the other and it's painful and red, that's a concern. That might be a blood clot. So definitely call your physician if you have any concerns regarding that. And I'll touch base more on that later on. Something important is going to be starting Kegel exercises immediately after delivery, if I could speak today. This movement is similar to stopping the flow of urine. So what you're going to do is squeeze for 3 seconds and release, kind of keeping that pelvic floor, the pelvic muscles toned, keeping them up. It kind of helps you prevent that stress incontinence later on. We always talk about how it's, moms sneeze and they just go. It's going to help you with that, help prevent that, make it a little bit easier. So you're going to be doing that, holding for 3 seconds and releasing for 10 repetitions twice a day. And you're going to move it gradually up to 100 reps a day, twice a day. Let's see here. Try to get as much rest as you can. I know it's kind of generous to say when you have a newborn baby. But, plan to take at least 1 nap a day, as you will be up frequently during the night with the baby. A good time to nap is alongside the baby. So I don't mean like the baby next to you. I mean, if little Timothy's asleep in his little pram or whatever, then make sure that you're sleeping too, because that's going to be your only chance to sleep at that moment. And, sleep's very important. Lack of sleep can affect your mood and can increase anxiety. We all know that from experiences. Allow friends and relatives to help with housework, cooking, and other chores. It's not at all a bad thing. Everybody needs help sometimes. If you need help, go ahead and phone up anybody you might have available. Shower as often as you like, but avoid tub baths or swimming until after your postpartum checkup. So your postpartum checkup is going to be scheduled for about 6 weeks following delivery, so about 6 months from yesterday. Let me see here. And basically, nothing should be inserted into the vaginal area for at least 6 weeks. That means no intercourse, that means no tampons, no douching, because it could really increase that risk for infection. Let's see. Driving should be avoided for 1 to 2 weeks or until the operation of an automobile will not be painful or cause undue exertion. So definitely don't be driving, especially if you're taking any kind of sedatives or any kind of medications your doctor may prescribe to you that might be sedating in effect. Let's see here. If you're taking any narcotics for pain relief, any kind of opioids or anything that have been prescribed, definitely don't do that. Definitely don't drive. If you have somebody else to drive you, please reach out to them first. Nutrition. Let's see here. So good nutrition and adequate fluids are necessary for tissue repair, healing, breastfeeding, and general health. Refrain from any weight-reducing diets until after your postpartum checkup. So we're not going to wait till the day after the birth of Timothy to start dieting. That's just going to really throw you off course, and it's just really going to not be a good time. So what we do recommend is if you are breastfeeding, continue to take your prenatal vitamins, very good for Timothy. Eat a well-balanced diet that is high in protein, fiber, and calcium, as well as maintaining those fluids. Up that water intake as much as you can. If you have a family history of food allergies or are concerned about food allergies for your baby while breastfeeding, consult your physician for guidance. Very important. If you're concerned that any of your medications, any of your kind of foods are going to pass through to that breast milk to Timothy and that he might be sensitive, please call your doctor. I mean, always a phone call away in terms of the baby's safety. Bowel care, very important. So it's normal to not be able to go to the bathroom sometimes for about 3 to 4 days following delivery. A diet high in fiber and fluids, as previously stated, can help avoid constipation, as well as walking. Walking promotes those bowel movements, promotes that gas, and increased general circulation. Raising your feet onto a stool. I know that Target actually sells what's called like a squatty potty. You can put that like right there in front of the toilet, and it'll put less strain, especially if you have stitches. So definitely duly noted on there. For constipation, take an over-the-counter stool softener such as Colace, Metamucil, or add prunes or prune juice or bran to your diet. Any additional questions, please contact your doctor's office. Urine changes. Your uterus should feel firm after delivery. You will feel contractions after delivery as your uterus works to get back to a non-pregnant size. These pains tend to get more intense with each delivery. Breastfeeding mothers may experience more cramping during and after feeding, especially in the early weeks. These contractions are temporary. Use relaxation or breathing techniques and the pain medications prescribed by your doctor to lessen discomfort. Let me see here. Yes, do continue to use that perineum bottle, the peri bottle, to clean your perineum, rinsing front to back with warm water. It's very important you do it front to back. You don't want to introduce infection, any of that E. coli, up into the vaginal area. Make sure to use your sitz bath as directed. So what you're going to do is, in case we haven't already discussed this already, just like I showed you earlier actually, you're going to get that sitz bath. You're going to place it right there in the toilet with that warm water filled up about halfway. And you're going to put about 3 tablespoons of Epsom salt. And make sure to mix that in, let it all dissolve. Then you're going to sit down there, maybe like 10 to 15 minutes or whenever you want to get up. I'm sure once it starts getting cold, it's not going to be as comfortable. So just, take your time with it. It's really going to help that healing and kind of debride anything that might still be down there. The first few days after delivery, your bleeding, also called lochia to us, is bright red. It changes to dark red, then brown, much like a normal period. This bleeding usually lasts 2 to 4 weeks, but you may notice light bleeding for up to 6 weeks, kind of like spotting you might have sometimes with periods. In the first days home, you may notice an increase in bleeding or darkening in bleeding due to increased activity. This may be a sign that you need more rest. If you're starting to get that heavy bleeding, but it's not like that super crazy, like, filling up the peri pad within 15 minutes bleeding, it might just be your body's way of saying, hey, slow it down a little bit. Like, we're trying to heal ourselves here, and you're kind of breaking up those blood vessels. So just, if you can, take it lightly. Let's see here. You might also notice that you pass some blood clots, especially if you've been sitting or lying down for long periods of time. This is completely normal, but what's not going to be normal is passing blood clots that are larger than about an egg. That might be a sign there's some clotting issues going on. There might be some underlying bleeding, so definitely call your physician immediately if you get those giant blood clots. If you're breastfeeding, your first period may not start until after you wean your baby. Success! Yes, upside. If you are not breastfeeding, your first period will probably start 4 to 6 weeks after delivery and may be unusually heavy. Remember, even if you are breastfeeding, ovulation and fertility can return at any time. So it is important, so important, to use contraception. And remember, you shouldn't be participating in any sexual activity for up to those first 6 weeks. But, if there's any odd circumstance that you feel like doing those 6 weeks, it's happened in the past. Just remember, at any time, fertility comes back. So, yeah, it's actually not recommended to have your baby for too close to Timothy's delivery. So it is recommended that children be spaced out at least 18 months apart to fully give your body that time to fully heal and relax back to where it should be. Let me see here. Yeah, let me know if I need to slow down a little bit. This is just so much information. I'm trying to get through it quicker for you. I know you're anxious to get home. Wear a well-fitting bra. Kind of helps with that sagging. Nurse the baby as frequently as possible. Make sure your baby is latched properly to avoid sore or cracked nipples. What you can actually do is express a small amount of that breast milk and kind of put it on the areola, on the nipple, and let it air dry. And that'll kind of help with that discomfort, help with prevention of cracking. Refer to the information included in this booklet. If your breasts become engorged the first few days, make sure to use ice packs for 15 to 20 minutes at a time. Lie flat while applying ice if possible. You can also use over-the-counter pain relievers if you must. Tylenol is definitely recommended. Just make sure to use it within the guidelines, no more than 6 times a day. Let me see here. Engorgement usually resolves in 2 to 3 days. If you're still experiencing significant discomfort, please contact your doctor's office for an appointment. You may want to contact a lactation consultant or the La Leche League for additional support and information. Any other questions, make sure to go ahead and, I'm not going to say Google that, because I know we've all, WebMD'd before and kind of just, scared ourselves out of our minds. So definitely call your provider if you have any kind of concerns. If you think the baby's not eating enough, that's usually monitored by how many diapers he's been having each day. He should be having about 10 or so diapers a day. Kind of lets you know that he's getting enough fluids. Bowel movements are less of a concern because he is having all those liquids. He should be having a few bowel movements each day, but if it's at least one, that's fine. I wouldn't expect that all that liquid's going to turn to the solid each time. But it is concerning if it's, white, very foul smelling, red, bloody, or black. Call your provider if you see that. Back to breastfeeding. If you have a fever higher than 100.4, a lump or red, sore, or hot area in the breast that does not go away after nursing, contact your doctor. Very important. That might be mastitis. And how we would treat that is by giving you antibiotics. And it's completely safe to still breastfeed Timothy during that. Might need to supplement him some Similac. If not, if you don't feel comfortable doing that, that's completely fine. Let me see here. Psychological adjustment. Families go through many changes when a new baby is born. Yes. All family members are adjusting. Mothers experience a wide range of emotions. Mild feelings of sadness, depression, and anxiety are common and are due to hormonal changes, lack of sleep, and the demanding job of caring for a newborn. These are frequently referred to as the baby blues. These feelings are usually temporary and self-limiting. Postpartum depression, however, is less common and more serious. It is characterized by feelings of depression, anxiety, worry, hopelessness, and lack of self-worth. It may also include thoughts of hurting yourself or the baby. Postpartum depression requires treatment by a therapist and often medication. Please contact your doctor or midwife if you or your family has any concerns about your mental health. Neither of these conditions reflects your feelings for your baby, your partner, or your abilities as a mother. You cannot control these feelings, but they can be helped. There are medications that are safe to take while breastfeeding. And there actually is, for reference on here, a Postpartum Support International helpline right here. So if you have any kind of concerns, any kind of feelings of depression, please contact your provider. Please call that helpline if needed. It's in no way something to stigmatize. It's completely normal. It happens more often than you would think. And not at all is something about your skill, nothing about your ability. Please reach out if you have any feelings of hurting yourself or Timothy. We definitely want to make sure that the both of you are safe, that both of you are happy. So just make sure, reach out if you have any of those feelings. If you need any kind of help. Let me see here. Other ways you and your family can adjust to a new baby. And this is just talking about being flexible, eating that well-balanced diet, the rest and sleep when the baby sleeps. Just kind of reminding you of the things we already went over. If you need any help with chores, going to the grocery store, please reach out to friends and family. Not at all something about your ability. When to call the doctor. Frequent urgency or burning upon urination might be a sign of infection. Temperature of 100.4 or above. That is the magic number, 100.4 or above. It's expected that you might have a higher temperature after the delivery of the baby, but 100.4, that's like the magic number for some reason. Anything above that or at that, make sure to call. Unrelieved pain in your back, side, or incision. Bloody or pus-like drainage from your incision. No bowel movement for 4 days or longer. If bleeding stays heavy despite rest, that could be a sign of a hemorrhage, as well as saturating a pad in an hour. Passing mini clots or passing clots larger than an egg. Let's see here. Foul smelling bleeding might be a sign of infection. Severe headache that is not relieved by a snack, nap, and Tylenol, or visual disturbances like blurred vision or tunnel vision. We all know that sounds kind of like eclampsia, preeclampsia. At that point, it'd be eclampsia, I guess. Very important that you would report to your provider about that. Social withdrawal or persistent baby blues or depression. Make sure to call that helpline or your provider about that. A hot, firm, red area in the breast might be mastitis. If one leg is much more swollen than the other, you have pain in your leg when walking, or there's a red, hot area, especially in the back of your leg. So that all sounds like a DVT, and I'll address that a little bit more right now. Let me see here. Okay, so signs of DVT is going to be warmth, redness, and pain in the one leg. Like I said, you might have swelling after delivery as your body's getting rid of that extra fluid. But if for some reason, like your left leg or your right leg is just more swollen than the other, super painful to walk, it's red, it's hot, it's kind of stiff, might be a DVT. So what you're going to have to do is go to the doctor, might refer you to the hospital, and it's going to have to be diagnosed by a D-dimer, and then probably eventually an ultrasound. And how we're going to intervene is basically tell you to lift up your legs, kind of help with that pressure, kind of help with the circulation of your leg. Compression stockings are going to help with the discomfort, help you get that blood flow back properly. Warm packs will help with the vasodilation, kind of help increase the circulation to that area. Ambulation, walking, that's what we say. Making sure to walk around, trying to help that circulation, trying to help get that blood clot broken up. And heparin is going to be typically what we give you. Signs of a pulmonary embolism, which is another clotting problem. So some people have that after birth as well. And how you're going to notice that is any shortness of breath, a dry, unproductive cough, chest pain, especially more on inspiration, fast breathing, lightheadedness, tachycardia, which just means like a fast heart rate. Wheezing or crepitus is what it's going to sound like to us. So when we listen to your lungs, it's going to sound like, you know, like a wheezing, kind of like grating sound. And our interventions are going to be giving you oxygen therapy, making sure that you're properly getting saturated. Probably an incentive spirometer, that little thing we gave you earlier that has like the little blue tube, and we have you breathe in. It's going to make sure that you're expanding those lungs properly. Probably managing your anxiety, because it is kind of hard, especially with the shortness of breath, to kind of help you calm down and get that proper oxygenation. So we're going to maybe kind of intervene and manage that anxiety. Yet again, we're going to give you probably heparin, kind of help break that clot. And that actually takes a few weeks to go away alongside that DVT. They both take like a few weeks to kind of settle out and dissolve completely. So you're probably going to have to get regular APTT tests to kind of just tell us that those blood thinners are working properly. Now, on to concerns with Timothy and how to care about him. Probably familiar with all these things already. It's just kind of helpful to make sure to remind you of those. Touch base on them a little bit before you leave. So this is about the feeding schedule. So I know that here we kind of had you on this feeding schedule of every 4 hours, kind of making sure that Timothy ate during that time frame. But once you're settled at home, most babies eat every 2 to 3 hours, much more frequently. And let me see here. If he's bottle feeding, it's going to be every 3 to 4 hours. There is rarely a strict feeding schedule in the early weeks. Baby kind of decides a little bit on that. although one will usually develop by 8 weeks or so. Until then, feed whenever the baby seems hungry. So he's going to seem a little bit more irritable. He's going to want to be sucking a lot. He's going to be probably fussy and crying. So, I mean, it's more of a given with a newborn. This is the keys to successful nursing is short but frequent feedings. Ideally, in the beginning, an infant will nurse for 10 to 15 minutes on each breast, about 7 to 10 times over 24 hours. Your breast milk is usually in by the 3rd to 4th day after delivery. So know that for in your case, yours hasn't really developed all that fully. So I know that we've been supplementing Similac while you've been here. Completely fine to keep on doing that at home. I know that you're real adamant, like you really want to breastfeed. If you still feel like there's any kind of complications, please reach out to one of our lactation consultants. I have their numbers on this paper as well. Let me see here. Early on, it is unusual for a baby to nurse as often as every 2 hours. Avoid allowing the baby to snack every hour. You're not going to be that baby's beck and call in terms of feeding. I mean, I know that it's completely fine to be worrying about how much they're eating, but as long as you're following that 2 to 3 hour time frame, Timothy should be fine. Gradually, as the interval between feedings increases to every 3 to 4 hours, you may increase to 15 to 20 minutes per breast and find that the baby will nurse less often. It may take 2 weeks, occasionally longer, for breastfeeding to become well established. I know it's going to be a completely new thing to you. Don't at all feel ashamed if it takes a little bit longer to figure it out. Please call us to help if you feel that nursing is not going as well as you had expected, of course. The baby's weight is usually checked in the office within 48 to 72 hours of discharge, which we did that this morning. He was completely fine. Let me see here. But of course, the next few days, if you feel like he's not eating enough, always call us. Whether you plan to breastfeed for a few weeks or several months, we recommend that you nurse exclusively for the first 2 weeks. I know your plan is to breastfeed. After that, it is fine to begin 1 bottle daily of expressed breast milk or formula. Weaning. At your 2-week office visit, we will discuss your feeding plans, how long you would like to breastfeed, whether or not you are returning to work, whether formula supplements are needed, and when and how to wean from breastfeeding when you're ready to do so. Formula feeding. Even though this isn't something that you're planning on doing, it's always good to touch base on, just in case, for whatever reason, you're not able to breastfeed. It says, if you have chosen to bottle feed your baby, unless there is a family history of milk protein allergy, we recommend that you start with a milk-based formula, aka Similac, Enfamil, Good Start, you know them. If the baby has trouble with this, we will recommend an alternative. Remember, the feedings are approximately every 3 to 4 hours, again, but without a strict schedule. Generally, a more predictable schedule develops by 8 weeks of age, again. I know there's some redundant factoids in here, but just don't mind it. It's just kind of to help ingrain it in you. At first, most babies take 1 to 2 ounces per feeding, but will increase fairly quickly to 3 to 4 ounces as they grow. By your 7-week visit, the baby may take 4 to 6 ounces per feeding. Remember to burp after each ounce. Once the baby is taking larger amounts, burp every 2 to 3 ounces and after each feeding. The baby might spit up a little bit. Make sure to have that burping cloth, as we were talking about earlier. Elimination. We expect newborns to have 5 to 6 wet diapers in a 24-hour period. So that was it. It was 5 to 6 wet diapers. This is one way you can tell if your baby is getting enough to eat. There is great variability in the pattern of bowel movements for the newborns. As many as 10 stools in a day, or as few as 1 stool every 10 days, can be a normal pattern, particularly if an infant is exclusively breastfed. Do not be concerned about the frequency of stools, as long as they appear soft and easy for the baby to pass. So remember, your baby is just ingesting all of that breast milk, so it's probably going to be very more liquid stools, if anything. It almost looks like pee. It's going to be yellowish, as long as it's not any variation of green, yellow, or brown, as long as it's any variation of green, yellow, or brown, that's cool. Call if you see any blood in the stool, chalky white, or jet black stools that could show any signs of bleeding or infection, so it's a no-no. So yes, 5 to 6 wet diapers, and then bowel movements, it's a little bit less strict. Jaundice, some babies will develop a yellow skin color in the first few days of life, especially if there was that positive Coombs test, which Timothy didn't have, but it's still good to touch base on. This condition is called jaundice and results from an accumulation of bilirubin in the baby's bloodstream. A certain amount of jaundice is physiologic, or aka normal. If a baby becomes jaundiced in the hospital, we will check a bilirubin level. Depending on the baby's age, if the level reaches a certain value, we begin treatment with phototherapy. Kind of helps break up the bilirubin. Infection control. I know that you were talking about this. I know you're saying that you and your husband already got flu vaccinations. All the outside immediate family did as well. Completely great to hear. Make sure to keep, those first few weeks, make sure to basically only have him have close contact with those close family members just to decrease the risk of him getting infection or any kind of flu. His little baby body can't really exactly fight that off just right and just yet. Let me see here. You can take Timothy out. I know that you were saying that you enjoy hiking, you enjoy going to the park, little strolls. So what you can do is take him out whenever you start feeling comfortable, whenever you're stable. Just make sure to not get in that sun exposure. His little baby skin is so thin and it's going to burn so easily. Let me see here. Hand washing, very important. Always wash your hands before touching him, before transferring on over to him. If you have small children in your family, let them pat his feet after washing their hands, of course. You never know what they might pick up on the playground. But that's about it. You can, they can hold him. I mean, after washing the hands, of course. Let me see here. Okay, umbilical cord care. So something about that is going to be, so of course he still has his little bump right now. What you're going to do is get an alcohol covered cotton swab and swab around the umbilical cord. It kind of helps dry it up. It's probably going to take about 2 weeks for the cord to fall off. Until then, don't actually submerge him in his little bath just yet. Give him little sponge baths, kind of wipe him off. You just don't want that umbilical cord to get wet. Increases the risk of infection. It's going to stay on longer because of that. You want it to shrivel up and just drop off. Let me see here. In terms of sleeping, as we were discussing yesterday, the infant should always be on their back and alone in the crib. Keep that crib or bassinet in your room for the first few months. It says by 8 weeks of age, most infants will begin to sleep 5 to 6 hours at night and entirely through the night by 4 to 6 months of age. So just make sure, remind you, I know that you might have like cute stuffed animals, that Afghan that your grandma crocheted and all that, but it's not good to have in his crib until he's at least well into a few months old, because he might not be able to turn over and he might suffocate. It's definitely a problem, especially here in America, that needs to be addressed more. So remember, on his back, properly swaddled, nothing else in the crib. Have that baby monitor, make sure that he's in the room. Parents often keep a newborn in a cradle or bassinet. Just remember that. Yeah, and definitely don't feel bad when you start transferring him. As he gets bigger, don't leave him in that bassinet. He might want to roll over more because it gets kind of cramped. Don't put him in your bed. Do not. There's too many incidents of rollover deaths with that. Don't feel bad about putting him in the crib once he starts to get older. It says at age 3 months, we suggest that you begin to develop a sleep routine, which includes putting the baby into the crib, sleepy but still awake, at both nap time and nighttime. By 4 months, the baby has learned how to settle down on his own to sleep and should begin to sleep 8 to 10 hours without a night feeding. So I know you're probably going to be looking forward to that after these next few weeks. Normal newborns. Sneezing and hiccups are normal for newborns. You may also note some noisy breathing caused by nasal congestion. If this occurs before feeding or prior to sleep, you may use saline nose drops and a nasal aspirator / bulb syringe to gently clear the nose. It's completely normal. He's kind of getting used to things, might be a little bit more allergic to just regular particles in the air. A creamy white discharge from the eye is common. I know that we know this, he had that this morning, but it's completely fine. This is not usually an eye infection, but rather results from a partial tear duct obstruction. Make sure to cleanse the eye with a cotton ball moistened in warm water. The discharge gradually disappears over several weeks and occasionally months. Babies often have a rash on the face or torso, which may resemble mild acne. Baby acne should resolve within a few weeks without treatment. Let me see here. want to make sure I've touched base. And then urgent problems we have listed here out in red. Call us for any of the following: a rectal temperature of 100.4 or more in baby 6 weeks of age or less. Making sure that whenever you take his temp, go ahead and put that lubricant on the end of it, gently insert it, just the tip of it. If it's above 100.4, it might be a sign of infection. Make sure to bring him in. Persistent vomiting 4 to 5 times in a row, especially over a short period, about 2 to 3 hours. Seizures or uncontrolled movement of the arms, legs, or torso, which cannot be stopped with mild pressure of your hand. I know babies are kind of finicky. They're a little bit more reactive. They have all those kind of reflexes. But as long as you put your hand on them, if they keep on having those kind of clonic motions, it might be a sign of a seizure. Definitely check in with us on that. Severe coughing or trouble breathing is another one. You might see that his ribs kind of go in a little bit. He might be kind of breathing real fast. That's not a good sign. Called retractions on our end. And then a serious accident or injury, of course, if he falls, gosh forbid, or if he rolled over during his sleep, of course, don't wait a bit on that. This is, don't forget to call your insurance company to add baby to your policy and bring your card to each visit, which I know we addressed that, like, before the delivery and everything. But that should actually be it. So I do have all these papers for you. I know it's a lot to digest at one time, even for me personally. Went kind of fast on that. But overall, I hope that that's been sufficient enough for you. If you have any questions or concerns, like we've mentioned like 15 times in here, make sure to call your provider. Go in. If you absolutely believe it's an urgent matter, go to the hospital. They're completely welcome, completely able to check in on him, make sure everything's all right. Completely normal distress. Remember to please call as well if you're experiencing any of those signs of the postpartum depression. If you have any thoughts of hurting yourself or Timothy, go ahead and please call us. Reach out for any help you might need. Any assistance with paying for feeding, if he needs more formula, more diapers. If you need assistance with that, we have all kinds of resources available. Case managers here as well. I can always refer you on over to them. But besides that, I mean, it's been so great having you here, and I hope you and Timothy have the best time, and hope you have a lot of fun. Yeah. Alright, well, thank you so much, and you take care, okay? Alright. Call us if you need anything.